Hi guys, so I kind of just wanted to come over here for a little bit and just talk to you guys in regards to, if you're in nursing school or you're kind of just wondering, okay, what are my professors looking for doing clinicals, and what are some things that I could do to be more successful during a clinical experience. So here are my tips for you. So I would say the first thing that I would recommend any nursing student to do is to be prepared, okay? I would say be prepared, kind of know exactly what you're going to be doing that day for your clinicals, and kind of make sure that you have all your materials, all your supplies ready, just to make sure that you are able to have all the things that you need to practice in the lab and to really go over all the stuff that you need to do, okay? So the second thing that I would say could be really helpful is make sure that you review beforehand. All right. There's a confidence that comes when you already review the material and you kind of get familiar with it. And not only that, but it allows you time to really write down maybe some questions that you have, or for your professor, so you can make sure that you get all your answers, all your questions answered during your clinical day, so that way you kind of already have a head start and you know exactly what you were unclear about when you were reading, and just getting all your questions answered. Okay, so other than that, I would say the next thing that could be really helpful is make sure that you participate, right? Participating, raising your hands, asking questions in class. I know for me, I tend to be more of an introvert, but if you are in a clinical setting, I would say ask questions and raise your hand. Volunteer for things, because not only it will give you more exposure to the task, but you also get to have a little bit more practice, and also you get a certain confidence when you get a clear understanding of what you're doing, and you get corrected if you make a mistake, because when you're in lab and you're in the clinical setting, especially in school, this is pretty much your safe space to be able to practice and make mistakes and get corrected before you have to do it in an actual real patient. So definitely volunteer for things, put yourself out there, ask questions, and make sure that you really get the full experience and learning how to do that skill. Okay, so the next thing that I would say is be confident, right? It goes a long way. Just make sure that we all knew we all have to start somewhere. Your professors know that you guys are learning, and it's okay to make mistakes. Just really be confident in yourself and know that even if it takes you a while to learn and understand, that you will eventually get it. Just really putting yourself out there, doing more practice and asking questions could really help to boost off that confidence. So just come in ready to learn and know that you are capable. That would really make a huge difference during your clinical experience and helping you to be more successful. Okay, the next thing that I would say that could really help you is to get creative. You're at home, when you already know what skill that you're going to learn, or after you learn the skill, go home and practice. Get some materials. Maybe you get to practice on a doll or whatever that you have. Make it work for you and really get the practices going at home, and not have to wait to only be practicing in your lab. You can get creative, and I know when I was in nursing school, I pretty much created a whole lab at home. So just, if you're practicing bed making, just try to do your bed the way that you are taught to do it in school. You're doing physical assessment, maybe you can do it on a family member, or, anything that you could use at home that could be really, really helpful. So get creative, make sure that you are prepared, and volunteer and be confident. You'll definitely, have all the tools ready for you to be successful. And the next thing that I would say that could really help you doing your clinical experience and being successful, and to make sure that you are on time, right? Because nursing school is already really stressful, and when you're arriving to places late, or stuff like that, it really adds to your stress. Because I know with most programs, maybe they won't even let you into the lab, and it's a lot of stress because nursing school is already stressful enough. So you want to make sure that you come prepared, come on time, and kind of make sure that you're really on the right mindset to be able to receive information and to learn. All right, so I love you guys. If you have any questions, just make sure that you put it on the comment section below, and reach out to me if you have anything. I love you guys. Bye.